Hi everyone, and thanks for tuning in today. We need to have a serious conversation about something that's affecting millions of men right now, specifically men over the age of 60. It's a topic that often gets pushed aside or dismissed as just another part of getting older. But the truth is, what we're talking about today isn't just inevitable aging. It's actually being driven by a specific daily habit that you might be doing right now, thinking it's good for you. Diana Lopez, a leading expert in men's urological health, has recently come forward with a critical warning. She has identified a dangerous daily habit that an estimated 78% of men over 60 are practicing religiously. The scary part is that this habit is silently damaging your prostate health, wrecking your bladder function, destroying your urinary control, and ultimately significantly lowering your quality of life. You might be wondering why your own doctor hasn't brought this up during your annual checkups. The reality is that most general practitioners don't warn seniors about this specific behavior until the symptoms have already become severe. By the time the conversation happens, the damage is often done, and the treatment options become much more invasive. The biggest tragedy here is the assumption. So many men assume that their urinary issues, the waking up at night, urgency, the discomfort, or just normal aging. You think, well, I'm 65 now, I guess this is just how it goes. But Parker's research suggests that for many of you, the underlying cause isn't biological inevitability. It is behavioral. It is something you are doing, and because it is a behavior, it is something you can change. Let's talk about what life looks like for the average patient dealing with this. If you are listening to this, maybe this sounds familiar. You're over 60, and you find yourself constantly scouting for bathrooms when you're out in public. You deal with frequent daytime urination that interrupts your work, your golf game, or your time with grandkids. Maybe the nights are even worse. This condition, known as nocturia, is incredibly common. You wake up 2, 3, maybe 4 times a night to use the restroom. You never get that deep restorative sleep your body needs to repair itself. The next day, you wake up feeling groggy, with low energy and a mental fog that just won't lift. Then there are the physical mechanics of it. You stand there waiting for the stream to start, and when it finally does, it's weak. You might finish, zip up, and walk away, only to feel like your bladder isn't actually empty. That nagging sensation of "I still need to go" follows you around all day. It chips away at your confidence. It makes you hesitant to go on long car rides or sit through a movie at the theater. It shrinks your world. So what is this hidden culprit? What is the one thing nearly 8 out of 10 senior men are doing that is making all of this worse? It is drinking excessive fluids. Specifically, it is the blind adherence to that outdated drink 8 glasses of water a day rule. Now I know what you're thinking. Wait a minute, isn't water good for me? Haven't I been told my whole life that hydration is the key to health? This is where the nuance is vital, and this is where Dr. Parker's warning is so crucial. That 8 glasses advice, it was largely designed for younger people with different metabolic needs, and crucially, different urological anatomy. It is general advice that does not take into account the specific physiological changes that happen to a man's body once he crosses the 60-year mark. Men over 60 simply do not have the same urological capacity as a 30-year-old. When you force feed your body water because you think you're supposed to, you aren't flushing out toxins, you are overwhelming a system that is already under stress. You are flooding an engine that is trying to downshift. Think about your urinary system like a plumbing network in an older house. When the house was new, the pipes were wide and clear, and the tanks were flexible and strong. You could run the water at full blast all day, and the system handled it perfectly. But now, things have changed. You have an enlarged prostate. This is a natural part of aging for almost all men. As the prostate grows, it wraps tighter around the urethra, the tube that carries urine out of the body. This effectively narrows the pipe. At the same time, your bladder, the tank, is aging too. It loses its elasticity. It becomes stiffer and weaker. It can't stretch to hold as much liquid as it used to, and it can't squeeze as hard to push it out. So what happens when you follow that 8 glasses a day rule? You are pouring a high volume of fluid into a system where the tank is smaller and weaker, and the drain pipe is clogged. This excess hydration creates a state of constant overfilling. Your bladder fills up, much faster than it can empty. Because the outlet is narrowed by the prostate, the bladder has to work overtime, squeezing harder and harder against that resistance to get the liquid out. Imagine a balloon. If you blow it up a little bit and let the air out, it snaps back to its original shape. But if you overinflate it, again and again, stretching it to its absolute limit every single day, the rubber eventually gets tired. It gets baggy. It loses its snap. That is essentially what excessive fluid intake does to an aging bladder. This constant strain leads to what we call overwork. Your bladder muscle thickens from the effort, which actually makes it less flexible, creating a vicious cycle. The pressure inside your urinary tract increases. This doesn't just cause discomfort, it causes damage. It trains your bladder to send urgency signals to your brain even when it's not full, leading to those frantic dashes to the bathroom. Dr. Lopez's message isn't that you should stop drinking water completely. Dehydration is a risk too, but the warning is about blind hydration, drinking out of habit rather than thirst. The idea that you must carry a water bottle with you everywhere you go, sipping constantly, is hurting you. If you are a man over 60, your body is telling you it cannot handle the same volume it did 20 years ago. When you ignore that reality and force fluids into your system, you are directly contributing to the weakening of your stream, the frequency of your bathroom trips, and those sleepless nights. The takeaway here is empowerment. You don't have to accept urinary misery as the price of admission for getting older. By understanding that your plumbing has changed, you can adjust your inputs. You can stop overloading the system. You can listen to your body's actual thirst signals, rather than following an arbitrary rule from a magazine article written in the 1990s. It's time to rethink the water bottle habit. It's time to protect your prostate and your bladder from unnecessary strain. Dr. Lopez wants you to know that you have more control over your symptoms than you think. And sometimes the best medicine is simply knowing when to put the glass down. We're talking about tangible, long-term harm to your bladder, your prostate, and your overall well-being. Let's start with the first major problem: bladder overwork and the muscle weakness that follows. Think of your bladder as a muscle that needs a healthy cycle of work and rest. When you consistently overhydrate, you force that muscle to work continuously without any downtime. It's like making someone run a marathon every single day. Eventually, they're going to collapse from exhaustion. An older bladder, which already has less stamina, fatigues much more quickly under this constant pressure. This relentless cycle of filling and emptying leads to a number of debilitating symptoms. The most obvious is a dramatic increase in daytime frequency. We're not talking about going a few extra times. We're talking about a reality where some men are visiting the restroom 12 to 15 times a day. Your life starts to revolve around bathroom locations. This constant state of urgency also weakens your bladder's muscle tone. It becomes less effective at both holding urine and fully expelling it. The result is a vicious cycle of feeling an urgent need to go, only to leak before you can make it, or to finish and still feel like you're not done. Your bladder is simply too tired to do its job properly. The second problem this habit creates is prostate irritation and chronic inflammation. For most men over 60, the prostate is already enlarged, a condition known as benign prostatic hyperplasia, or BPH. This enlarged prostate squeezes the urethra, acting like a clamp on a garden hose. When you drink excessive fluids, you are trying to force a high volume of water through that narrowed opening. This dramatically increases the pressure inside your urinary tract, right at the site of the prostate. This constant pressure irritates the prostate tissue, leading to increased swelling and inflammation. It takes your existing BPH symptoms and puts them on steroids. You may experience painful urination as your bladder strains to push fluid through the constricted, inflamed area. Your urinary flow becomes even weaker and more difficult to start. And that persistent, nagging feeling of incomplete emptying, it gets worse, because the bladder is fighting a losing battle against a swollen and irritated prostate valve. You're essentially aggravating the very condition you're trying to manage, all because you're following outdated hydration advice. Now, let's talk about the nighttime urination cascade, or nocturia. This is often the most disruptive consequence of overhydration, especially if you're drinking a lot of fluids late in the day. Your body doesn't just shut down its processes at night. When you go to bed with a surplus of fluid in your system, your kidneys continue to produce urine, filling up your already fatigued bladder. This leads to multiple nighttime awakenings. Waking up once might be manageable, but 2, 3, or even 4 times a night is destructive. This isn't just an inconvenience, it's a serious health hazard. The poor, fragmented sleep caused by nocturia has a domino effect on your entire body. It disrupts the natural production of critical hormones like testosterone. It leads to a noticeable decline in cognitive function, that brain fog that makes it hard to concentrate and remember things. It also puts a higher stress load on your heart and can elevate your blood pressure. The research on this is alarming. Studies show that men who wake up 3 or more times a night have a 67% higher risk of falls, often during those drowsy trips to the bathroom in the dark. They face a 54% increased risk of cardiovascular events like heart attacks and strokes. And they have a 73% greater chance of experiencing significant cognitive decline. The impact on quality of life is immense. You are chronically tired, your health is actively deteriorating, and it can all be traced back to the amount of liquid you consumed the day before. This brings us to the 4th major problem, the medication trap. When you go to your doctor complaining of these symptoms, the frequency, the urgency, the weak stream, the standard response is often a prescription pad. You'll likely be prescribed drugs like tamsulosin, which is meant to relax the prostate muscle, or finasteride, which aims to shrink the prostate itself. While these medications can offer some symptom relief, they come with a host of significant side effects. Patients often report dizziness, which further increases that fall risk we just talked about. Many men experience sexual dysfunction, which can be devastating to their confidence and relationships. Cognitive side effects are also common, compounding the brain fog from poor sleep. Yet, throughout this whole process, the root cause, the excessive fluid intake, often goes completely unaddressed. The doctor prescribes a pill for the symptom, but no one tells you to stop overloading the system in the first place. This creates a cycle of lifelong medication dependence. You end up managing side effects from a drug that's treating a problem being actively worsened by a daily habit you don't even know is harmful. The truth is, by understanding how overhydration directly damages your bladder and prostate, you can take a powerful step toward reclaiming your health. You can break free from the cycle of symptoms and side effects. It's not about abandoning water, it's about smart hydration. It's about listening to your body's real needs instead of an arbitrary rule. By adjusting this one simple habit, you can reduce the strain on your system and start to heal without immediately resorting to a lifetime of pills. In our previous segments, we've discussed how the common advice to drink 8 glasses of water a day is actively harming men over 60, leading to bladder overwork, prostate irritation, and severe sleep disruption. Theory is important, but today, I want to show you what this looks like in the real world and provide a clear, actionable plan to fix it. Let's talk about a real patient case that perfectly illustrates this problem. This was a 68-year-old man, let's call him John. When he came to see Dr. Parker, his quality of life was in shambles. He was waking up 5 to 6 times every single night to use the bathroom. 5 to 6 times. He wasn't sleeping, his energy was gone, and his days were a fog. He was already on 2 different prostate medications to manage his symptoms, and they weren't helping enough. His urologist had told him the next logical step was surgery. John was understandably desperate. During his consultation, Parker asked him about his daily habits, including his fluid intake. John, like so many men his age, was proud of how much water he drank. He was diligently consuming 10 to 12 glasses of water every day, believing he was doing everything right for his health. He thought staying flushed would help his prostate problems. The first thing Dr. Parker did was simple. She ordered a urine test. But this test wasn't to look for an infection, it was to measure the concentration of his urine. The results were immediate and undeniable. John was not dehydrated. In fact, his urine was so clear that it confirmed he was significantly overhydrated. He was flooding his system, and it was pushing him toward an operating table. This is a critical turning point. John was on the verge of an invasive surgical procedure, yet no one had ever questioned the sheer volume of liquid he was forcing his body to process every day. So what was the fix? It wasn't a new pill or a complex therapy. Parker implemented a straightforward, age-appropriate hydration protocol. First, she had John significantly reduce his total water intake. Second, and just as importantly, she had him fundamentally shift the timing of his fluid consumption. The goal was to front-load his hydration during the day and drastically reduce it in the evening. The results were nothing short of astonishing. Within just 2 weeks of starting this new protocol, John went from waking up 5 or 6 times a night to only waking up once or twice. After 6 weeks, he was consistently sleeping through the entire night for the first time in years. Think about the impact of that. He was finally getting deep, restorative sleep. Within 3 months, his symptoms had improved so dramatically that he was able to stop taking one of his prostate medications entirely, with his doctor's approval. The change in John was profound. He reported a major improvement in his energy levels and mental clarity. The constant anxiety about finding a bathroom faded away. His urinary control was better than it had been in a decade. His confidence returned, and with it, his quality of life. He avoided a costly and risky surgery, not with a new drug, but by simply stopping a harmful habit he thought was healthy. This story brings us to the most important part of our discussion, the correct hydration protocol for men over. This isn't a rigid, one-size-fits-all rule, but a smart guideline. For most men in this age group, a total daily fluid intake of around 6 to 7 glasses, which is about 48 to 56 ounces, is a much safer and more effective target. However, the when is just as important as the how much. You should aim to consume about 70% of your total daily fluids before 3 p.m. Your system is more active during the day and can process it more efficiently. After 6 p.m., your intake should become very minimal. A few sips to take medication is fine, but chugging a large glass of water before bed is setting your bladder up for a long, busy night. You can also use a simple visual guide, your urine color. Aim for a light, pale yellow. If your urine is consistently clear, like water, it's a strong sign you are overhydrated. You are simply drinking more than your body needs. Another key piece of this puzzle is remembering to account for fluids from your food. Fruits, vegetables, and soups contain a significant amount of water. An orange, a bowl of oatmeal, or a cup of soup all contribute to your daily hydration. Many men who think they're drinking 10 glasses of water are actually consuming the equivalent of 12 to 14 glasses when you factor in their diet. You're getting more fluid than you realize. To wrap things up, let's review the key warning signs that your bladder and prostate are overstressed from excess fluid. If you notice these symptoms, it's a clear signal that you need to reevaluate your drinking habits. First, are you urinating more than 8 times during the day? That's a sign of overwork. Second, are you waking more than once per night to use the bathroom? That's a classic symptom of nocturia, often driven by evening fluid intake. Third, do you experience sudden, powerful urges to go that are difficult to control? That's your bladder signaling it's under constant strain. Fourth, do you have that persistent feeling that your bladder never fully empties? And fifth, is your urinary stream weak or difficult to start? These are not just normal parts of getting old that you have to accept. They are direct signals from your body that your urinary system is overloaded. John's story is proof that you have the power to change your situation. By adopting a smarter, age-appropriate approach to hydration, you can reduce the strain on your body, improve your symptoms, and dramatically enhance your quality of life. We've exposed the myth of 8 glasses a day for seniors. We've looked at exactly how excessive fluid intake overworks your bladder and irritates your prostate. And we've shared the incredible story of John, who reclaimed his life simply by changing how he drinks water. Now, it is time to put all of this into action. You understand the problem, and you've seen the proof. But you might be wondering, okay, I have these symptoms right now. How do I fix them? Today we are going to walk through a specific reversal protocol designed to help you take control, reduce your symptoms, and potentially get off those medications for good. The first step in this reversal protocol is immediate implementation of the age-appropriate fluid intake we discussed. This is the foundation. Remember, we are aiming for about 6 to 7 glasses of total fluid per day, with the vast majority consumed before 3 p.m. The beauty of this step is how quickly your body responds. Unlike some treatments that take months to show results, most men begin to notice improvements in just 7 to 10 days. Your bladder, finally given a chance to rest from the constant deluge, starts to recover its natural rhythm. You'll find yourself rushing to the bathroom less often during the day, almost immediately. Step 2 is about rebuilding strength. We need to add pelvic floor exercises, commonly known as Kegels, to your routine. Now, I know what you might be thinking. Aren't those for women? Absolutely not. They are critical for men too. These exercises strengthen the specific muscles that support your bladder and urethra. Think of it like tightening the washer on a leaky faucet. By strengthening these muscles, you directly reduce that feeling of urgency and help prevent those embarrassing leaks. It gives you back the control you feel you've lost. Step 3 is all about tracking. I want you to specifically track your nighttime awakenings. This is your best indicator of progress. Don't worry as much about the daytime frequency at first. Focus on the night. Keep a simple log next to your bed. How many times did you get up? 2? 3? As you stick to the new hydration timing, stopping most fluids after dinner, you will see those numbers drop. This usually improves steadily over a period of 4 to 6 weeks. Seeing that number go from a 4 to a 1 is incredibly motivating and proves that the protocol is working. Step 4 is the goal many men dream of: working with your doctor to reduce your medication. Once you have corrected the root cause, the overhydration, and strengthened your muscles, the need for drugs like tamsulosin often decreases. Many men find that once they aren't artificially stressing their system with excess water, their natural function is enough to get by without pharmaceutical. But please, do this in partnership with your doctor. Don't just flush your pills, show them your progress log, and have the conversation. Dr. Parker's core medical recommendation boils down to a simple shift in mindset. She urges all men over 60 to stop drinking excessive fluids out of habit. We need to collectively retire the 8 glasses a day myth, because it simply does not apply to senior physiology. Instead, adopt a senior-specific hydration strategy that respects the changes in your body. By doing this, you aren't just treating symptoms, you are preventing nocturia, stopping urgency in its tracks, and reducing chronic prostate irritation. The most important message she wants you to hear is that most urinary decline in older men is behavior-based. It is not an inevitable slide into disability. It is reversible. Now, while fixing your habits is the primary cure, some men may want additional support to speed up the healing process or provide extra protection. This brings us to optional nutritional support. For gentle support, you might look at something natural like watermelon extract. Specifically for a compound called L-citrulline, this amino acid is fantastic for improving circulation, better blood flow to the prostate, and bladder supports smoother urinary flow and helps repair tissues that have been strained by years of overwork. It's a mild, effective way to help your body heal itself. For those looking for more comprehensive help, there are advanced senior urological formulas available that combine several potent ingredients. You'll want to look for a blend that includes saw palmetto, which is widely recognized for its ability to reduce prostate inflammation. Hygiene is another key player. It's known to improve urinary flow and overall bladder function. Pumpkin seed extract is excellent for strengthening the actual bladder muscle, helping with that emptying problem. Nettle root can help balance hormones that affect prostate growth. And again, L-citrulline boosts that critical circulation for recovery. Using a comprehensive formula like this can offer several benefits: faster healing of irritated tissues, a more noticeable reduction in urinary symptoms, and improved long-term prostate health. Ultimately, this translates to better sleep and greater comfort. But remember, these supplements are the allies, not the commanders. The commander is your daily fluid habit. No supplement can outwork a bad habit if you're still drinking 12 glasses of water a day. So what is the final takeaway from our series? It is that excessive fluid intake is the hidden, silent cause of urinary misery for millions of men over 60. It is a self-inflicted wound, driven by well-meaning but outdated advice. You have the power to change this. Small strategic changes to your hydration can be the difference between surgery and health. They can be the difference between a lifetime of medication side effects and a drug-free existence. They can be the difference between waking up exhausted every morning and finally getting the deep sleep you deserve. This is about more than just bathroom trips. It is about protecting your dignity. It is about being able to sit through a movie, drive to see your family, or play a round of golf without panic. It is about transforming your quality of life. So start today. Put down the water bottle in the evening. Listen to your body, correct your hydration, protect your prostate, and sleep through the night again. Thanks for listening, and here's to your health.